Welcome to another season of the ASTIT podcast, where we turn science into sense. In this season, we are introducing you, our listeners, to some of the Justice Community Opioid Innovation Network, or JCOIN, family. In episodes 1 and 10, you will hear from our funder, the National Institute on Drug Abuse. And in episodes 2 through 9, you will learn about cutting-edge and recent science published by some of the investigators working in the Learning to Advance Practice, or LEAP, program, a part of JCOIN. This is so exciting. So let's get started. I'm Danielle Rudes, your host, and this is ASTIT. Welcome to this bonus episode of the ASTIT podcast. We don't do this very often, but when we learn about good news, we want to share it quickly. And what I'm going to tell you today is not only good, it's great. It is, in fact, life-savingly great. Here goes. Per the Center of Disease Control and Prevention, or the CDC, for the first time since 2018, drug overdose incidents are declining instead of rising. Between 2023 and 2024, there was a roughly 10% drop in overdose-related deaths. This is fantastic news. So, on this episode, we're going to talk about all the falling overdose rates and some of the reasons that experts offer to explain this decline. Okay, so first, let's discuss what sort of geographic patterns we're seeing in the overdose rates. When we look at a map of the United States, we can see that most of the drastically declining overdose rates are occurring in the East. And as we move to the Western states, we're seeing less of a drop. And in fact, some states like Washington and Nevada, we're actually seeing an increase. Alaska has seen the biggest increase, with their drug overdose deaths up nearly 42% in 2024 compared to 2023. North Carolina has seen a big decrease, with their drug overdose deaths down nearly 23% in 2024 compared with 2023. This is interesting. Why are we seeing overdose rates falling in some parts of the country while rising in others? Well, the answer to that is complicated, and we'll unpack it for the rest of the episode. Let's talk about some of the reasons that experts are giving for this drop in overdose rates. Given that this is all happening in real time, it's a bit too early to tell exactly what is causing the decline, but there are quite a few hypotheses being thrown around. In fact, there's 7 main claims. The first, and perhaps the most prominent, is the increased prevalence of Naloxone, which is a drug that reverses the effects of overdose. Sugarman and colleagues 2023 report that much of the higher prevalence of Naloxone can be credited to federal grants that help saturate local markets with the drug. In the U.S., you can buy Naloxone at pharmacies without a prescription or get it free from clinics and harm reduction organizations. In interviews, many people who use drugs share that themselves or their friends now carry Naloxone and are prepared to use it if necessary. That comes from a report by the National Public Radio in 2024. For instance, in Seattle, one survey found that 85% of people who use high-risk drugs now carry Naloxone. However, not all the evidence supports this hypothesis. For instance, the distribution of Naloxone has been geographically patchy, since it doesn't match with state-by-state spread, the spread I talked about earlier. And purchasing Naloxone, even after the nationwide rollout supported by federal grants, can be rather difficult. Take, for instance, the experiences of some people interviewed by NBC News. In some stores, Naloxone was locked inside cases and obscured by metal poles or placards, making it difficult to find. And Naloxone can be expensive at $45 a box. There's also a lot of societal stigma around buying the drug. So while Naloxone is a promising solution to reducing overdoses, there are still some clear barriers in place. The second reason offered is improved and expanded treatment for opioid use disorder. Now, healthcare providers no longer need a special license to prescribe buprenorphine, a common and effective treatment for opioid addiction, and some clinics can offer take-home doses of methadone. Some experts also argue that the culture around opioid use disorder treatment has changed to be a little less stigmatizing. For instance, Dr. Elizabeth Salisbury Afshar, an addiction physician at the University of Wisconsin-Madison, said that now buprenorphine is being treated like any other medicine. That report comes from the New York Times in 2024. Some experts also still call for treatment to be more holistic. For instance, in Massachusetts, Lieutenant Governor Kim Driscoll argued, quote, "Our administration continues to invest in community-level supports rooted in destigmatizing substance use disorder by meeting people where they are and understanding the ways in which factors such as housing and economic insecurity intersect with health." Unquote. Access to medication-assisted opioid use disorder treatment, or MOUD, has expanded for populations who need it most, namely incarcerated people. According to Binswanger and colleagues 2007, people who are released from incarceration are between 56 and 129 times more likely to overdose than members of the general public. As such, people who are incarcerated are disproportionately at risk for overdose. However, the vast majority of prisons and jails do not offer MOUD. That comes from the Pew Charitable Trust in 2023. A recent study conducted by Balawajder and colleagues in 2024 found that areas with lower social vulnerability, so factors like lower poverty, lower unemployment, and better housing and education, and closer distance to MOUD providers were more likely to offer MOUD treatment to incarcerated people. Additionally, other factors such as cost, insurance, and regulations impact availability. But the research suggests that offering MOUD to incarcerated people dramatically reduces overdose. Like a 2022 study conducted by Lim and colleagues that found an 80% decrease in overdose mortality for those who were provided with MOUD while incarcerated. Other studies found similar results, like Kemper and colleagues in 2023, who found that overdoses decreased after statewide MOUD implementation in correctional facilities. These studies all suggest that availability of treatment reduces overdoses. However, it is unclear how much improved or expanded treatment has contributed to the decline in overdose deaths. For instance, while buprenorphine has become more available and more easily prescribed, there has been no major uptick in prescriptions, as reported by the University of Michigan School of Public Health in 2024. Additionally, other studies find that there has been little change in the number of patients receiving buprenorphine, suggesting that just because the treatment is more accessible, it is not necessarily being utilized any more frequently than in the past. Another explanation is targeted law enforcement activity and a reduced drug supply, particularly with drugs coming in from the southern border. Basically, over the last few years, law enforcement has targeted and tried to interrupt the flow of opioids, primarily fentanyl, and other drugs into the United States. They did this by increasing border security and by targeting 27 micro networks that were responsible for last-mile street dealing. Additionally, in 2023, the Sinaloa cartel, who was at one point the leading exporter of fentanyl in the United States, stopped producing and trafficking the drug into the U.S. after coming under pressure from U.S. law enforcement. Since this decision, the number of fentanyl pills seized at the southern border has decreased. However, the timeline between these activities and the drop in overdoses doesn't quite line up. As Dasgupta 2024 points out, if law enforcement actions had been effective in reducing overdoses, if we look at a graph, we would see spiky drops in overdose rates. However, what we do see is a relatively smooth downward trend line, which doesn't match with these efforts. So maybe increased law enforcement has something to do with the decline in overdose deaths, but right now, the evidence is inconclusive. Next, we have the introduction of xylazine. In the past couple of years, drug manufacturers are increasingly mixing fentanyl with another drug called xylazine. Xylazine is a veterinary tranquilizer that acts as a depressant. According to the United States Drug Enforcement Agency, or DEA, fentanyl is being cut with xylazine because of its low price, accessibility, and long-lasting effects. According to a report put out by the Office of National Drug Council Policy within the Executive Officer of the President, it's a mouthful, in 2024, xylazine was found in 36% of powdered fentanyl seizures. Xylazine has a sedative effect, which can be pretty sporadic, aka it affects people differently each time they take it. Injecting the drug also causes some pretty horrible skin wounds. However, xylazine also has some rather unexpected benefits. According to Dasgupta, 2024, studies have found that xylazine bonds to an opioid receptor in the brain, which then actually makes the effects of opioids last longer. This means that people may be actually taking less doses or fewer doses of opioids per day, thus lowering their risk for overdose. A study conducted by Love and colleagues in 2023 supported this conclusion, finding that people who used xylazine had lower odds of cardiac arrest and coma compared to those who used opioids without xylazine. Additionally, due to the skin wounds caused by injecting xylazine, people may be turning to other ways of taking drugs, like snorting or smoking, which are less likely to cause overdose than injection. And experts suggest that improved and more available drug testing strips may have something to do with decreased overdose incidence. These drug tests help provide people who use drugs the ability to detect the presence of fentanyl or xylazine. The geographic spread of xylazine and lower overdose rates also tracks. Xylazine is spreading east to west, as are reductions in overdoses. All of this information lends support to the argument that xylazine may be a contributing factor in lowering overdose rates. Next, some people suggest that increases in tolerance, or what is fancily termed depletion of susceptibles, may decrease overdose. Experts who offer this reasoning argue that once you've developed a tolerance for a drug, which occurs when you've been repeatedly using it for a long period of time, you build up almost an immunity to it. Essentially, it takes more and more of a drug to reach the same level of high. So, people have built up a tolerance to it, which puts them at a lower rate for potential overdose. Additionally, over time, people gain more and more experience with using drugs and are better able to measure their doses and prevent overconsumption, leading to overdose. Dasgupta states that this is a plausible reason for why overdose rates are dropping, but it is likely one factor among many. Some experts have noted that the legalization of marijuana may have something to do with the decrease in overdose rates. Essentially, folks are arguing that states with marijuana legalization would have lower overdoses because people may prefer using marijuana as opposed to opioids or other drugs. However, this reduction in overdoses doesn't follow the geographic pattern of marijuana legalization. For example, we're seeing lower overdoses in states where marijuana is illegal, and higher doses in states where marijuana is legal for recreational use. This suggests that marijuana legalization is not a contributing factor for lowering overdoses. Finally, we have the end of the COVID-19 pandemic. During COVID, overdoses spiked, which experts largely attribute to a lack of treatment access and increased stress and isolation and mental health challenges. That comes from scholars Gose and colleagues, 2022. Some experts argue that the end of COVID caused overdose rates to drop. Essentially, they believe that these noted challenges disappeared, which then caused the overdose rate to decline. It was largely accepted that COVID was a driving factor of increasing overdoses. However, one study conducted by Moghaderi and colleagues 2023 found that COVID might not actually have been that big of a driver of the overdose crisis. From their retrospective study of CDC data on overdose mortality from 2015 to 2021, the authors concluded that observed overdose increases can actually be explained by a continuation of pre-COVID trends toward higher overdose rates. Said another way, the authors do not find evidence of COVID as a primary driver of rising overdose mortality. This suggests that COVID may not actually have had much to do with rising or declining overdose rates. All right, so now we've talked about some of the explanations for the drop in overdoses, and now it's really important that we talk about two populations that are not seeing the same trends. The data shows that overdose rates remain high among Black and Native American communities. This is from an NPR report in 2024. For instance, in Massachusetts, a report conducted by the Department of Public Health in 2024 found that while overdoses declined among white, non-Hispanic men, overdose deaths increased for Black non-Hispanic men and women, as well as Native American non-Hispanic people. The same report found that people living in rural areas also had higher overdose rates compared to those who lived in urban areas. Thus, when we're looking at the nationwide figure of declining overdose rates, we need to consider who those numbers actually reflect. It remains paramount that we prioritize accessible, helpful, opioid use disorder treatment for these high-risk populations. Okay, so with that, we've reached the end of our bonus episode on declining overdose rates in the United States and our discussion on the reasons why that might be occurring. We're seeing some really promising statistics, and there are some interesting reasons as to why we're seeing this decline, but we can't say for certain which, if any of these, is the most likely factor, or if and how the factors themselves are related. Before I say goodbye for this episode, let me also note that if you enjoyed this episode, you may also be interested in season 9 of the ASTIT podcast, which covers harm reduction in 10 really informative episodes, and or season 10 of the ASTIT podcast, which covers overdose in, again, 10 really important episodes. Additionally, if you heard information in this podcast and you would like the citations to be able to read the information for yourself, go to the ASTIT or JCOIN website at www.jcoin-ctc.org/JTech, where you will find the ASTIT podcast, and you can look for this episode and you will find all of the article citations and a one-page overview recap of everything we talked about in this episode. Thank you. See you next time on ASTIT. Thank you for listening to the ASTIT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me, Danielle Rudes, at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Opioid Innovation Network, JCOIN, their Coordination and Translation Center funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters on this season, Sam Houston State University doctoral students Alexa Mata and Bryce Kushmerik-McCune. And a huge and heartfelt thank you to Jason Luchin and the team at Slonky LLC for their amazing production. Tune in again soon for another episode of ASTIT.